So the power switch on should be on, and then once you've done that, you have to make sure that if it is previously used, this mat should be cleaned, and then it should be dry. It should not be wet anytime. Okay. There is one more spare is available, so make sure that it's dried and then there is no dust, because this is the area the air sucks and then it will produce the oxygen. Then the second thing is this water. It's like a water bottle. Then make sure these things are packed enough or tightened enough. Okay, and this is another place, because this is where you will get the oxygen concentrator. And then every time we can open this, and then fill up fresh water. Okay, if it is a Bisleri water or whatever it is, and then fresh stuff, fill in the fresh water. Keep it here, and then make sure it will be like so properly. Then you will plug it here, right? Then the next thing is we'll be connecting the tube actually, and you can show it closely.
It to you. Normal concentration of oxygen in room air is 21%, and this is what the concentrator takes out and then provides to you in a relatively pure form of oxygen. Now, when we use oxygen outside of a hospital setting, at home, or as we discussed in a RWA designated area, the oxygen can be delivered by nasal cannula or by a mask, face mask. Now, typically we would start with a nasal cannula, which is a simple tubing, and the tubing has two ports which are placed inside your nostril. After placing them in your nostril, then on either side the tube hooks around your ears, and then you can tighten it so that it is secure. The tube is then connected to the oxygen tube that comes from the oxygen concentrator. So it attaches to the oxygen concentrator, then you set it to the level required. It can be 2 liters or 3 liters. Alternatively, if it's an oxygen cylinder, it's the same mechanism, and you connect it to the oxygen cylinder. While you're doing this, it's important to monitor with the pulse oximeter what the patient's oxygen levels are. So the oxygen level less than 94 is the indication for oxygen, and once you have given the person oxygen, we expect it to go above 94%.
We'll be switching on the. So once you switch on, you have to wait for like 1 minute until it gets reading and everything will get started. And this is the gauge. So this is a more important thing. Based on the doctor's advice, we have to adjust the liter of oxygen, which is required. So if you could see 0 to 5, if you need a 1 liter per minute, or it's all based upon the doctor's advice. So you can adjust this knob to increase or reduce. To make it confirm whether it's working properly or not, you can see the bubbles which will be started doing in this water.
Just increasing the intensity. You can see
and then it will increase. The bubbles will get increased.
This is
oxygen level once you switch on until you plug the tube into the nose. So once you plug this knob, and then you will get to know what is your oxygen level. And then the oxygen level will indicate whether it is increasing or reducing, whatever is required.